Since there is no actual patient, candidates must verbalize all actions, including questions to ask of the patient, assessment steps, interventions, and orders that you, as the leader, would provide. Begin with scene management and progress to a systematic patient assessment as you would conduct it in the field while communicating with your patient and EMS partners. State exactly what you are assessing and what care you wish to provide. The oral station requires paramedic candidates to verbalize in detail how to assess and manage a patient based upon a specific scenario. This station is completed by providing a simulated radio report of the call to a receiving hospital, just like you would do in the field. The skill examiner at this station will play the role of patient, bystanders, and other healthcare professionals. Throughout the oral station, you should assume that your local medical control has granted you permission to perform any intervention you desire. To avoid forgetting some important aspect of the call, such as the patient history, assessment of findings, or treatment, you will be provided with a pen and paper to take notes during the station. You can refer to these notes at any time during the station.
Welcome to the oral board station. This station requires that you verbally complete an assessment and treatment for a simulated medical patient encounter. You can assume that there will be an EMS provider that will carry out appropriate assessment and management of treatment that is directed by you. You will have 15 minutes to complete this station. Your time will begin when I hand you the case. Please read it aloud and then begin. Do you have any questions?
No. The case is you are a paramedic on a transporting ALS unit. You and your paramedic partner are working for a suburban EMS system. At 12:17 hours, you are dispatched to a local residence for an unknown medical emergency. You have a 5-minute ETA to the scene. You are 20 minutes to the nearest hospital and 10 minutes to the nearest urgent care facility. It's a summer day with a temperature of 82 degrees. You're met at the residence by a man identifying himself as the patient's son. Okay, can I start now?
Yes.
This was dispatched as an unknown medical emergency, so do I have any other information? I'm concerned about the safety of myself and my crew going to the scene.
The dispatcher has no other information.
Okay, so even en route to the call, the dispatcher is not able to go ahead and communicate with anybody on the scene?
He's unable to get in touch with anyone.
Okay, I'm probably going to go ahead and request assistance, maybe in the form of law enforcement or an engine company backup, because I don't know what I'm going to be encountering when I get there. When we roll on up to the scene, I'm approaching a house. Is that correct?
Yes.
And do I see anything there that's out of the ordinary? Is it a normal dwelling?
It's a single-family home, one level.
Okay.
And the son meets you at the door.
Oh, okay. All right. So, okay. All right. Well, we'll position our unit and go ahead and pack up all of our equipment onto a stretcher. Since this is an unknown medical emergency, I'm going to be concerned about bringing just about everything I can, thinking it could actually be a cardiac arrest situation. So we would proceed to go ahead and move our equipment to the unit, or from the unit to the house. And as we enter, I'd go ahead and identify myself to the patient's son and tell him I'm the medic and ask what seems to be the problem.
Okay. The son tells you that he called his father this morning and was unable to get a response. So he came by this afternoon, and when he arrived, he was unable to wake his father.
Okay. I'm assuming now at this stage that the scene is safe. Well, we have our BSI precautions, and I would ask the location of the patient.
Patient is lying in bed at the back of the house.
Okay, so we're going to try and get our equipment on back into the back bedroom. Is it convenient, or am I
You're able to get your equipment into the back room?
I can get my equipment back there.
Yes.
Okay. As I enter the room, what do I see? Like, can I see the patient right from the doorway as I'm entering?
Yes.
Okay, and what do I see?
Patient is laying still, does not appear to be moving, does not respond when you walk into the room, or does not look at you.
Okay, can I hear anything? I mean, is he breathing? Do I hear that across the room at all?
Patient has snoring respirations.
And how about the age of, this is a male age? And
73 years old.
73. Okay, and approximate weight?
About 165 pounds.
And race of the patient?
Hispanic.
Okay, and the only family member, only other member there, no bystanders, the only other person there with me is
The son is with you.
the son. Okay, I think I'm going to begin patient assessment at this time. Okay. So I approach the patient, and you said he had snoring respirations.
Snoring respirations.
I would position him. Do I see any signs of trauma?
There's no signs of trauma. There's nothing in the environment to make you suspect trauma.
Okay, and the patient is positioned on the bed, yes. I understand. How about around the area? Do I see any signs of medications, spilled medications?
The bedroom environment is clean. There's nothing that looks out of place or gives you concern. And no medications visible.
Okay. Then I'd like to go ahead and begin with a chief complaint on this patient. So I'd start by tapping and shouting and saying, sir, I'm a paramedic, can you hear me?
There's no response.
Okay, so the patient is unresponsive. What about to painful stimuli? I might go ahead and do a pinch on the trapezius.
There's no response.
Okay. I'd open his airway because you said he was snoring, so I would want to go ahead and try and open up his airway, just doing a head tilt chin lift.
All right.
Does that correct the snoring?
Snoring respirations are gone. Respirations improve.
Okay, so obviously he's breathing, and I would go ahead and just in general, is he breathing fast or slow?
Respirations appear to be slow.
And how about pulse? I will go ahead and check a carotid pulse and a radial pulse.
Carotid pulse is at 58, radial pulse is at 58.
Okay. Okay, I'm going to go down. I think at this point I'm going to go ahead and have my partner go ahead and put this patient on oxygen, 15 liters, non-rebreather. And I'd like to have him begin to take vital signs on the patient. I would go ahead and try and gather up additional information about the patient from the caregiver, the son at this time.
All right. Your partner is taking vital signs now.
Okay. I'm going to use the mnemonic sample, so I would start with the signs and symptoms. What I see is altered level of consciousness and no signs of trauma. How about allergies? Do I have any known allergies?
The son does not know of any drug allergies.
And what about medications?
The son reports that the patient takes glucophage, Cipro, Coumadin, and Percocet.
Okay, what's the patient's pertinent medical history then?
Can you clarify what you're asking for the patient, the son?
Yeah, I'd like to go ahead and know the medications that you've given me, like glucophage, is for diabetic. And I'm trying to go ahead and determine if he is diabetic.
Yes, the son says that the father is a type 2 diabetic.
Okay. And then he's on an antibiotic and a blood thinner and a pain medication. So I'm trying to go ahead and determine what those are for.
Okay, the son reports that the father had a hip replacement 6 days ago.
Okay. Okay. How about his last oral intake? When was his last meal?
The son was with him last night for dinner, which is probably about 18 hours ago, and the son does not know if the father had breakfast this morning.
Okay, so he may not have eaten in about 18 hours. Okay. What about the events that led up to this? How did the son find him?
The son normally calls his father in the morning. When he called this morning, there was no answer. So